right, so this is another episode of Off the Cuff Nurses, and I am Dr. Minter.
And I'm Nurse Bryan.
And we're here to talk to you about correctional medicine and just life in general, because it's off the cuff. So how was your week?
My week was good, busy with work. I was watching some Netflix films, and it kind of got my mind thinking about how people, steal identities and all this other things. So I was...
Were you watching a show?
I was watching a show. I think it's called, I don't know what it's called, but it was about this guy that basically stole all these women's identities and was causing a ruckus, I guess, with their lives and things. So I was laying in bed, under my covers,
After a night shift?
After a night shift. It was after a night shift. And I'm sitting there and I'm Googling myself, and I Google my maiden name because it's so unique, So I Google myself, and I start to scroll down, and I'm seeing all these familiar things like, track and field or cheerleading or whatever. Then all of a sudden I get down to the middle and I see
Tell us.
my maiden name with sex with so-and-so. And I'm like, and one said dirty MILF something. And I was like, I'm sorry, what? And I see the first one, I see the second one, I see a third one, and I see a fourth one.
You mean just like the...
Yeah, like the website. So and then I click on each one, and they're kind of like an umbrella of them because they're all the same font and the same everything, coloring, lettering. So I guess once you're a part of one, they kind of put you on all of these sites.
Oh, really?
Same picture, same name, same stupid bio they used.
Yeah, but what was it? What did it say? Yes, you can.
So bad. Hey, hold on. Actually, I might have to look it up on my phone. Hold on. It's so funny. It said, that's what it was. It said meat and so, and I'm like, and it's a picture, and the crazy part is they used a picture of me from back when I was probably early 20s, 21, 22, 23, something like that.
Before kids and all that.
Before kids. And they
before
had
night shift.
Before night shift ruined me. So yeah, so it had my maiden name, made up age, but it had from where I grew up. It said that on there, kind of, pretty specific. So I was horrified, told my husband about it, and I'm like, what do I do? And he's like, go, if you can, he's like, message them. So I went on the bottom of the website, and I saw where you can message them, to report abuse. So they put on there, what's the subject? So I put everything in there, and I told them to take it down immediately before further action is taken, which I don't know what that means either, but I was just threatening them. So now if you Google it and you click on it, it says invalid, but it still has the link to click on it, though, with my name. So I still have to talk to him about that because it's still on there.
So was it a good picture?
It was a great picture of me. I'm
really?
glad, yeah, back before filters. So it was a really good picture of me, but still, oh my gosh, but it just goes to show that any picture you put on there, anyone can take.
Well, where'd you take?
It's free game.
Where'd you take the picture?
In my room. I think I used the window for good lighting back then.
Yeah, but what were you using it for?
I think I want to say it was MySpace or something. It was really old, or maybe it was Facebook, but yeah, so there's that. So I had an interesting week, but they did get back to me, and they were like, "Oh, we take this very seriously." I'm like, "Oh, right. Do you?" I'm like, "Take it off now." Oh my gosh, horrified. Yeah. So, but like I said, now I got to get on to them about taking down the link to even click on it with my name. So, but I occasionally I'll Google myself, and it wasn't on there 6 months ago. So this must be a relatively new website with my picture and everything. So there's that.
How long ago was it?
What, the
picture?
Well, the picture was back when I was 21, 22, and I'm 32 now. Yeah. So it's an old picture of me, yeah. But it's a good picture of me, thanks, but, no thanks. I don't want someone advertising sex under my picture.
You gotta be famous for something.
I guess. Yeah, I think it was a cat. Was it Dirty MILF? I think it was Dirty MILF. It's one of them.
Never even heard of it.
Me either. I don't really.
Until you started Googling yourself.
Mm-hmm. Yeah. So there's that. What about you? How was your week?
It was pretty good.
Anything interesting happen?
No, got a big egg for your kid.
Mm-hmm. I'm so excited about it. I think I'm more excited than he is.
Yeah.
Yeah.
So I was thinking about work-life balance. And one of the things with corrections, it's when you're working full-time, is how to balance out kids and work and everything. I mean, my kids are grown. Mm-hmm. But one of the things I like to do is go pick up eggs from my chickens. Mm-hmm. So I, got you an egg. So this is a regular egg.
Mm-hmm. Standard egg.
Yeah, it's a standard egg.
Yeah.
So this is a Dawson egg for your son.
Yeah, isn't that cute?
Yeah. Blue egg.
Oh my God, that's awesome.
Yeah, so that chicken had a hard time with that egg. But anyway, my chickens are going crazy with stuff like that. But yeah, it's just kind of relaxing that, with all the stress of when you're working in jail and kind of try to go home and at least have some sort of hobby.
Yeah, try to.
Well, yeah, and try to be somewhat healthy.
Yeah, I think yesterday I slept from 6:30 at night till I got up at 7 this morning. So literally all night. Didn't even wake up once.
Yeah.
That's good sleep.
That's a long time. Yeah, so I was thinking we could talk about maybe over the years mass casualties that I've encountered because they pop up here and there. And they happen in corrections too. I've had them more happen in hospital setting.
What is your most memorable?
So I think the most memorable mass casualty, unfortunately there's been more than one, was when I was working in Maryland in a hospital. So it was and I never call out unless I'm sick. So I was working a contract in the ICU. The ICU was on the 3rd floor, brick and glass building. It was a nice day, and I was like, I really want to call out. And no, I knew they needed somebody there. I was like, all right, now I'm going in. And I remember I got gas right next to the hospital, and then started working. I was working day shift then, back normal, 7 a.m. So it was like, I don't know, it was right at the end of shift. It was like 6 o'clock. So I had a guy on a ventilator or on a vent. And then I had another guy who was just had a heart attack. And he was talking, but he was, we had him leashed down with wires because monitoring his heart. But I mean, he was not on a ventilator. He was more stable. So I'm in the front of the hospital in this guy's room that's ventilated, and I'm overlooking this huge out on the town. So I'm standing next to one of the nurses who's from the Midwest, and I said, "Do you think that's a funnel cloud?" And she said, "Yeah, that does look like a funnel cloud." So a funnel cloud is where it's not a tornado, but it's sideways.
Right.
I don't know some weather guy will probably say, no, it's a blah, blah, blah cloud.
Yeah.
I mean, all I know from being in the military and up in North Dakota was that a funnel cloud is the precursor to a tornado. So we're in the middle of Maryland, so I'm like, my brain can't catch up to this. And that's one thing about mass casualties is that I've done a lot of reading about, is that your brain has a hard time catching up. Is this actually happening? And that delay causes more problems.
Right.
Because you don't think like, is that wave, that tsunami is not really coming towards me, right?
Right.
Yeah. So we're watching it. And so we watch this funnel cloud come down. And we're like, we're just talking. We're like, do you think that's a tornado? Like chatting. Like we should have just had like a little tea, right? And she's like, yeah, I think that's a tornado. I said, it's like you and I just chatting here. I think that tornado is coming our way.
Oh my gosh.
And then, so there was one of these water towers. It was like 200 feet high. And it was like kind of off in the distance at the edge of town. And it ate up the water tower.
Oh my gosh.
And then all you see is this water tower was like a couple 100 feet high in the tornado, which looked like a toy. So it looked just like the Wizard of Oz from like
scary.
The 30s, right?
Yeah.
And we're like, that tornado just ate up that water tower.
Oh my gosh.
And it's coming our way. And so it starts coming our way, and the whole hospital started to shake. And they sound just like a freight train. Just like a freight train. And it's so true. So the whole brick cement hospital starts shaking. So it was ginormous. It was like huge. Anyway, later on they found out it was like, it was on the brink of an F4, F5 tornado. La Plata, Maryland tornado. It was in 2002, I think, or 3. And so it hits the hospital. And then that window cracked. Of course, I dove under the nurse's station. And right before that, the hospital operator, they're supposed to, you have all these codes in hospitals, code greens, code pinks, codes, code this, code that, right? No, the hospital operator gets on and she's like freaked out. Yeah. Right. And she's like, there's a tornado coming. Everybody died. Yeah. So that helps like people not to panic. And then all the visitors start screaming and then of course my guy on the vent can't do anything. Right.
No, just laying there.
Anyway, it hits the side of the hospital. And then the hospital stood, thank God. Of course, all the lights went out. But the generator did come on. Usually when things go wrong, it's like a multitude of things.
Right.
But this time it held and the generator lights came on. So we had a few lights. And I'm like, am I going to have to ventilate this guy for the next 3 hours? But anyway, that's why they say plug the ventilator into the red outlet because you need to.
Right. There's reasons behind this.
So anyway, then everybody gets up. And we're like, is it over? Or I said, are we in the eye? And then one of the nurses like, no, that's a hurricane. But, I was thinking like we're in the middle of it. You know what I mean? But no, it was gone.
Right.
But most of us didn't have cell phones back then, if you can believe that. And so one of the nurses was a ham radio operator. And of course, she brought her ham radio. Who brings your ham radio into the ICU?
I guess this lady.
She did, and we were really glad she had it that day.
Awesome, yeah.
So she radios the other ham radio operators when we're outside of Washington, D.C. So, of course, that was like the biggest thing that they had ever, and they got the word out to EMS because there was no way of getting EMS out. So we looked outside. And there was and the day shift was coming in, and some of the day shift got caught at the corner. They didn't even get in hardly. Because the doors were shut. We looked out, and it was just utter devastation. It was just like nothing was standing. I'm like, my car was over there. And then the gas station where I had gotten gas was gone.
Oh, my God.
Totally gone.
Yeah.
Right? So the guy who had the heart attack or whatever he had, he's in bed and he's like, honey, look, I know you got rules here, but I got to get out of here. He says, I got to get home. I said, how are you going to, you just had a heart attack. He's like, I know, but so he rips all his leads off, right? And he said, good luck. And then he walked out into the night and I never saw him again.
Yeah.
And that was the end of him. But so I called, then that was the only phone that actually dialed out. So his phone was the only one that dialed out.
And he's gone.
And he's gone.
Right.
Right. So I picked up the phone, and I don't know why his patient phone worked. So I called my house, and I got my ex-husband, which was my husband at the time, and I said, hey, there's been a tornado, blah, blah, blah. And he says, oh, I'm glad you called. I said, there's a tornado, I don't know when I get home. I don't know where the car is. And he says, I'm glad you called. Your mother can't find her garage door opener. And I was like, did you just hear me? Right?
Yeah.
Did you? I said, whatever, So that tornado wound up, it was a Sunday. It leveled an elementary school, but there wasn't anybody in it because it's Sunday.
Oh, thank
so,
God.
yeah, I know.
Yeah.
It killed about 10 people. But there were people just like walking around with they were bleeding and, just blood running down their face and everybody's just walking past them. It was crazy. And then they shut down the town and they're like, you can't leave. I'm like, well, it's 1:00 in the morning now. I had been there since 7 a.m. because I was going to call out. Remember, I was going to call out, but I didn't call out. And we talked to the police because they were afraid of looting. And we're like, look, we got to get out of here. So we stepped over one of the nurses and her husband. We walked about a mile because my car was like, there's no way I could drive it out. Plus, there was live power lines down everywhere.
Oh, my gosh, yeah.
And
scary.
Walked about a mile, and then they got me home, in the middle of the night. That was the day I was going to call out.
Goodness.
So the La Plata tornado was probably the worst out of all of them. Second worst was right after Oklahoma City. I was working at Andrews Air Force Base, and remember the bombing? and in Oklahoma City. Well, anyway, I was working again in ICU. I was a charge nurse, and I don't know, I might have been a hospital supervisor. So they come in and they say, the MPs come in or whatever they were, and they said, we found a package in the hospital, and so we brought the dogs in. We brought the bomb dogs in, and the dogs think it's a bomb. We're like, well, we got a full ICU here. What do we? They said you got to get out. We're like, where?
Where are we going?
Where are we going? Well, it was July, so it wasn't snowing or anything. They're like the parking lot. I said, we got to get 250 patients out in the parking lot. I'm like, okay. So we had this lady, she was like, just had surgery and she didn't want to budge. Like something minor, like an appendectomy or what. I don't know why she was in ICU. And she's like, just leave me here. I'm like, don't tempt me. Because we got a bomb threat. And then they say, all these things where they say, like, don't use the elevator. Well, how are we going to get a patient with all these drips out?
Yeah.
So anyway, no, we used the elevator, and I was like, just held my breath because we only had to go like one floor down. And then we put somebody unlocked the clinic, and then we put all the patients in the clinic. And we had this old World War II nurse, and she was like 90-something. And she's like, honey, I'm like, what? And she's like, if you put this patient over here, and if you put this over here, and then you could do whatever. And I'm like, she's right. She was like 97.
Yeah. So she knew what she was talking about.
I know. And I was like, you're not having any chest pain? She's like, oh, I brought my nitroglycerin. So she grabbed, I don't know how she had nitroglycerin on her. She's like, I'm good. Just keep taking care of everybody else. So that was a couple of them that I've been in.
Wow.
Yeah. But, you learn something new every single time that you do it. Nothing ever goes completely right.
Right. Yeah, I know with codes, it's like, for me, I know I've been in corrections for about 5 years now, maybe a little over. And it seems like the more I go to, the more comfortable I get, the more calm I get during them. I'm not so frantic. I remember when I first started out, I was like, like you're just so nervous you can't find things or whatever. But it seems like with time, I'm getting more calm and collective and starting to delegate tasks to other people and being like, okay, hey, go ahead and get this ready, or go ahead and get the ambu bag ready, things like that. So, but yeah, I remember the beginning was rough. When you're a new nurse, you're just so frantic, it seems like. Right. Yeah. Well, and I think, and the more you do it and the more you train, the easier it gets. Yeah. I know where I work, we do man down drills like around the clock. It seems like every so many months we're getting an email saying, hey, we're going to have a man down drill, and they seem to help because it helps you get familiar with where things are in the code bag. Usually you are grouped with people during the I guess code things, I don't know, that you work with already. So it seems like when you're with them, it seems like, when you do have a real code, you're with those same people. So it's like you're getting familiar with how they work as a nurse and how you work. And it seems to work really well. So. Yeah.
When I was in the hospital, when I was a hospital supervisor, we had an excellent physician. He was an ER physician, and he came up. We had a terrible, terrible code, a young girl. And he was like, let's keep it down. He said, I'm in charge. But then he's like, so he established that he was making the decisions, but then he would ask, does anybody have any other ideas? So, he elicited opinions from the other staff members.
Right.
But in the end, he made the decision.
The ultimate decision,
yeah. Yeah, he would. Yeah, it was, and she lived. So and having that rapport is, it's whoever sets the tone, as they say in ER, and keeping everybody calm.
I remember when I was working in the ER as a brand new baby nurse, we had a lady come in, and the EMTs brought her in, and they were in active, chest compressions. They put her on the table, and it was so quiet in there, like you could hear a pin drop. And that's what I remember talking about in nursing school, was like you should be able to hear a pin drop during that code, which is supposed to be, like I said, like a frantic type, you're trying to save somebody's life, but it was so quiet. I think the only thing I could hear is like the machine every time they'd go down, like beep, 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 that's all I could hear. So it was pretty incredible to be a part of that too.
Yeah, it's pretty unusual though, because most of the time that doesn't happen.
No. And usually it's more, chaotic because, like I said, you're trying to save somebody and it seems like it always happens at the wrong time. So, yeah, I remember that happened. And then, unfortunately, the patient didn't make it. And I had 3 other patients that, were behind on meds. So we cleaned her up and got everybody out and let the family have time to kind of say their goodbyes and everything. And so I start heading to my other patients' rooms. I'm opening the curtain. I'm like, hey, here's your medications. They're like, where were you? I'm like, what do you mean? I'm like, someone just died. And they're like, oh. But some people aren't really, like patients, they're not really understanding of like what you just went through. And like, you have to like, even if you're upset, whether you're, you were just crying or whatnot, you have to kind of take that off of your face and go to the next patient. But I had patients get really nasty with me about, having been in a code and then being laid on their Tylenol or whatever it was.
Right.
Or whatever pain medication it was, morphine or whatever. So.
Right. Well, it's because they don't, they have no concept as to what's going on in the next room. Mm-hmm. Yeah. And I've found that over the years, less now, I think, because I feel like I've seen almost everything. And every time I say that, something new happens. So I'm like, no, I've seen that. Mm-hmm. No, I haven't. I was more stressed out when I was a hospital supervisor. That was more stressful. Is you wind up recovering for days at home.
Right.
Like I found that I would sleep a lot, and I think you just need brain rest after some sort of traumatic event like that. Yeah. Even if you don't think that you do. Right. You do. Mm-hmm. And it's like you don't do anything. Right. Like I don't do the laundry, I don't do the dishes. Mm-hmm. Like I said, there's more, not recently, but in the past when I've had some big trauma. Yeah. Like the Air Force issue or, of course, the tornado. Mm-hmm. Then it takes a while for your brain to actually catch up to that trauma and process it. Mm-hmm. And then other things tend to fall by the wayside. Like, I think your brain can only handle what it can handle. Right. So, like, you're like, oh, I had an appointment. Oh, I had this. And, you blank out with all the little stuff because you just can't handle all the stimulus. Mm-hmm. That's what I think. Yeah. That's just my I know when I'm stressed out like that, it seems like I'm sleeping a lot more, or I try to sleep a lot more, but it's kind of impossible with kids and trying to get them around and everything. So, yeah. So right. I get that. Right. Yeah, there's a good book. It's called 4 Days in Memorial. Mm-hmm. It's about Katrina. So when Katrina hit, some of the hospitals responded a certain way, and they had, I think almost all of them had no power. And then the generators got flooded in Memorial. Mm-hmm. It was like 4 or 5 days in Memorial. And so it explains like how nothing went right with that particular hospital, but the hospital around the corner had a bunch of, I think, Vietnam veterans that were physicians or something, mm-hmm. and how they I don't know what they did. They went out to the parking garage and then used like the car batteries or mm-hmm. whatever, whatever they could. Yeah, right. And just the trauma from that whole incident where patients, they had to make decisions about patients, and there was hardly any food, so anyway, it was a pretty good book. Yeah. So anyway, you never know what you're going to come across. No, you don't. And I know everyone copes differently, like you said, like in these casualty events or even in patient deaths. I remember, I probably shouldn't tell this story, but I remember when I was a new nurse. But you will. I will. I remember being a new nurse, and same thing happened because I was in the emergency room. Had a patient come in active chest compressions, and we're trying to bring him back as a team. And I was new, so I had a preceptor with me. His name was Chris, and he was, helping me through the whole shift. And usually I had somebody else, preceptor, but he was my preceptor that particular day. And I remember we had lost the patient, and then like I said, with the other patient, gave time for the family to come in and say their goodbyes and everything, because they were like falling to the floor. Of course, it's like a scene out of a movie. When you lose somebody, you can fall to your knees and cry. And so I was behind on my patient, so I helped, with that
patient. Then I go and help with my other patients. And I basically picked up where I left off. And then later in the day, he was like, hey, I need to talk to you about something. And I'm thinking, what does he want to talk to me about? I'm like, this is so weird. And the way he said it, so I'm like going around the ER. I'm doing everything but call him on the radio. So I find him and I said, hey, what did you want to talk to me about? And I was almost done with my training. I was about to be on my own. And he's like, I just want to talk to you about the code that we had. I was like, sure. He's like, if you can't show compassion for your patient, maybe you shouldn't be a nurse. I was like, I'm sorry, what? And I think it's because I was a new nurse and he maybe expected me to be like tearful or something like that. But he basically, I wasn't going to cry in front of everybody, and fortunately for me, it wasn't a patient that I had been, had for days like you would have in like trauma or in med surg or something like that. It was a patient that had just came in fresh from the streets, basically. But, I didn't have that bond with him. But of course, like when you lose somebody, you're going to feel that loss in your heart, as a nurse. But basically, I didn't cry. I just picked up where I left off, which I thought was the right thing to do. But in his eyes, I think he thought that maybe, I was supposed to cry or something like that. I don't really know. But yeah, that happened to me. So I felt like the rest of the shift because I'm like, oh my God, what did I do wrong? Like, was I supposed to cry? Was I supposed to, go in there and hold the family's hand? Like, I don't know. I just let them have their time with their loved one, and we closed the curtain so that they can have their time. But yeah.
Did he?
No.
Oh, well,
see,
maybe that's the expectation, though.
I'm not sure, but I felt really bad about it, though. Because
Well,
I was like, maybe I should have, been different. But I think it would take a lot for me to cry at work, even when we lose a patient. But that's everyone's different. Everyone copes differently.
Right.
So,
yeah.
And like you said, sometimes it takes you a few days to even be like, did that just happen or whatever?
Well, and the more you do it, and the more you wind up seeing stuff, you just wind up getting a little bit hardened to it. I've seen a lot in the last 34 years.
Yeah,
So you just don't, it's not that you don't feel compassion, but.
Right. I just had to pick up where I left off. And I think like I said, as a new nurse, you're kind of like, oh crap, I have all this crap to do. Cause you see like on the screen, the red, you're like, oh God, that's missed. We got to get that done. So.
Right.
But yeah.
Yeah. All right. Well, this is another episode of Off the Cuff. I am Dr. Minter.
And I'm Nurse Bryan.
And we will talk to you next time.